Hello and good morning, everyone. Welcome to our latest installment in the IAQ webinar series, this time hosted with none other than the K-Health in Air project. So please, audio and video settings, some housekeeping. Please turn off your camera and mute your microphone. It should already be done for you. The webinar is being recorded, so if you want to speak, please be aware that it is being recorded. So if not, please keep your microphone and camera off. Presentations that are used today will be shared after the webinar. We'll send it over maybe 2 or 3 days after. Questions and comments, please don't be scared. Ask your questions, ask your comments at any point in the chat. They are most welcome, and they will be answered either today or after the session. And please, if you'd like to have captions, kindly click on More Than Language and Speech, where you'll find an option to turn on live captions. So let us begin. Beyond the well-documented health impacts of poor indoor air quality, the damage to the environment and to human health also carries substantial economic costs. In fact, the Clean Air Fund estimates that the economic cost of air pollution amounts to approximately 3 trillion, while the European Environmental Agency does not assign a precise figure. It does note that air pollution results in significant health burdens, each of which entails considerable economic consequences. In some countries, the damage to ecosystems alone is estimated to exceed 5% of the GDP. At the same time, research from Columbia University and the London School of Economics finds that every dollar invested in air pollution control, particularly indoors, could generate up to $30 in economic benefits. The European market for indoor air quality management is also growing rapidly and is projected to exceed 1 billion euros in the coming years. Integration of indoor air quality technologies is increasingly becoming a standard feature of sustainable building design, supporting both economic growth and public health improvements. In this context, the K-Health in Air and IAQ projects, both members of the Ideal Cluster, are convening the latest session of the IAQ webinar series to examine the following questions. What are the economic costs of poor indoor air quality across Europe, and which mechanisms and sectors drive these costs? What economic and commercial opportunities arise from effective indoor air quality management across Europe? And finally, which emerging solutions illustrate this economic potential, including data-driven tools such as the No Center Indoor Air Quality Dashboard? So with that, I'm honored to say, joining us today for this timely discussion, I'm proud and honored to introduce our outstanding panel for today's latest installment in the IAQ webinar series. Starting from the left, we have Dr. Phil Webb, Chief Executive Officer at Health and Wellbeing Limited, Dr. Salias Matolovicius, Founder and CEO of Brevio, Dr. Leticia Perez Saiz, Researcher in Biomedical Sciences at Caviloce, and a dear friend of mine, Jaime Gersic, Research Fellow and Project Manager at the No Center. Thank you very much for joining us today. So just a quick run through of our agenda for today. We've done the welcome and introduction. Now we'll be going to the economic burden of poor indoor air quality in Europe with Phil. Then we'll be heading to the business opportunities behind better indoor air quality management with Salias. Then we'll be heading to Leticia from research to impact, the K-Health in Air exploitation strategy. And finally, in terms of presentations, we'll go to Jaime with the No Data Platform, a market-ready dashboard for IAQ monitoring and visualization. Finally, we'll have some panel discussions. Then any burning questions that you have can be answered during the interactive dialogue and questions from the audience. Just a reminder, you can ask questions at any point during this webinar. And please do, so we can build up a real nice bank of questions. And then finally, we have some concluding remarks. So with that, I will stop speaking. I will ask most of our panelists to turn off their cameras except for Phil, and I will hand over the floor to Phil. Phil, the floor is yours. Take it away.
Thank you so much, Alex, for that excellent introduction. Delighted to be opening this webinar for IAQ. I'd like to talk about how we're actually looking at the importance of assessing economic burden in this sector, some of the pitfalls and downfalls from some of the current traditional approaches that are being used, and potentially a new and more granular way of assessing both clinical and cost consequences in looking at the specific importance of the indoor environment for built environment for health and well-being. Next slide, please, Alex. So it's important to start off that there are existing approaches to measuring the burden of disease and economic impact across Europe. The problems with the current methodologies are largely that these use quite old and outdated epidemiological data to construct models, which are general population models looking at both clinical and cost consequences, largely around ambient or what we call outdoor air quality monitoring. That actually means for the indoor environment, some of these methods that are currently used may not be applicable because they often overlook indoor environmental quality factors such as ventilation, temperature, light, humidity, and noise, which actually shape somebody's real-time exposures to pollutants and toxins and other environmental impacts indoors. And the methods are actually used for outdoor air quality monitoring, and that might not be particularly applicable or suitable for looking at the impact of concentrations and exposures that are very different indoors than they are outdoors. The other problem about these models is that there's no real risk stratification, so it makes it very difficult to actually determine the types of exposure, the duration of exposures, or the actual impact on the persons exposed in indoor environments. And it doesn't adjust or stratify for inequalities or potential bias in the data leading to more inequalities when you extrapolate that information out and use it for modeling purposes. This ultimately leads to a very generalized assessment of both clinical and economic impact, and a difficulty in understanding the real impact of specific interventions with no real understanding of the clinical or cost consequences associated with intervening. This makes it very difficult for governments to prioritize funding resources and to attribute them to effect sizes they expect when those interventions are actually applied in indoor environments in particular. The lack of prioritization action ends up that this conversation is a macroeconomic effect and measurement, and it doesn't allow us to understand how interventions actually intervene in context for complex systems, and it doesn't allow us to be able to predict or model unintended consequences of doing particular interventions to resolve problems. Next slide, please, Alex. There is, however, an existing framework which allows us to have a new hope in how we actually determine both size effects clinically and the economic burden in terms of outcomes from an economic perspective. It's based on a utilities method that's already been used for over 4 decades in health to assess quality of life and burden of disease from an economic perspective. And it allows us to look at specific interventions in the built environment to be assessed for cost effectiveness and be able to prioritize. And I was lucky enough to be on a seminar with an international group called GoAQS, and this is one of the areas where there is an existing hole in what methods and frameworks we use to apply to the actual assessment of impact for interventions in the built environment, and why this is going to be critically important to us collectively if we are to move forward with a progressive and prioritized agenda across Europe. IEQ measures can be captured alongside using monitoring technologies to link and to be able to model environmental change with health improvement and health impact. And this point becomes critical. Some of our other panel members will talk about how this could be done from a data perspective. And it's actually based on prospective data collection, actually collecting information on the impact of interventions on actual health utility, and not just using old epidemiology and bridges to modeling. Importantly for us collectively, it allows us to stratify and risk adjust, and allows us to look at the impact of particular interventions on certain vulnerable patient groups like infants, children, adolescents, young persons, working age, elderly people, and people of experience, versus the costs of intervening in these groups, so we can get an accurate assessment of both the cost of the intervention and the intended health impact improvements for doing the intervention on an economic basis. Critically important, the values that we will be using are already comparable and adjustable across European populations through over 4 decades of work. So this is an easily usable and comparable way of assessment that can be used across Europe or even internationally. Next slide, please, Alex. So what I'd like to do is illustrate what I've just done with a real data example. So we collected prospectively baselines and post-intervention, and the intervention was mobile filtration in a home environment in a child with severe allergic asthma. We used internationally recognized disease-specific instruments and the general quality of life instrument licensed through Euroqual, which is the EQ5D3L. For anyone who's got a health economics background, these are general tools that have always been used to assess the clinical and cost impacts of things like drugs. We collected data at baseline and 3 months post-intervention according to the administration manuals for both instruments, and we analysed the effect sizes using the appropriate online calculators, which are open source and freely available. They do not cost anything to use. The results in our study noted a 38-point measurable improvement in quality of baseline to near perfect health status for a child with allergic asthma who was acutely unwell in over just a 3-month period from intervention. There was also a consistent 52.8-point increase in the St. George's Respiratory Questionnaire, a questionnaire that's routinely used to assess impact for drugs in children over a 3-month period. On clinical review, the child in question had a significant reduction in asthma medications, some of which were very expensive asthma medications, an improvement in fitness and exercise with a 13 reduction in waist circumference. So the interesting point for this is these types of interventions in improving indoor air quality not just affect respiratory disease, but potentially could impact on people developing things like childhood diabetes. A 13-point waist circumference is a significant difference in waist circumference and leads to implications for cardiometabolic disease for children growing up. We also noted lower anxiety and depression scores and wider impacts on families, which is really important to assess, because the thing about interventions in buildings and the built environment is that the impact is not just on the people that we actually get data from, it's about the people who use the building. So the distribution of effect sizes is far greater than that would be for a drug which is prescribed to only one individual. The clinical gains observed also aligned with measured improvements in indoor environmental quality within the home environment. Next slide, please, Alex. So what would be the clinical and cost consequences of mobile ventilation in the home environment on targeted populations? So if we extrapolate this data specifically for children who are 12 years old currently in the UK, there are 1.1 million school-aged children with a clinical diagnosis in the UK of asthma, and 8.9% specifically are 12 years old, which is 97,900 children currently in school. If the quality of life gains are consistent and the cohort can be propensity matched, which is basically matching up individuals to make sure we're comparing apples with apples, each child having a mobile ventilation unit in their household for the time that they're spending in their household would gain over a lifetime 2.1 years of lifespan and 31.74 quality adjusted life years over a lifetime, improving both lifespan and health span. Over the population of 12-year-olds specifically with allergic asthma, this would equate to 3.1 million quality adjusted life years over that population's lifespan, and would significantly improve their lifespan of over 200,000 life years added to that cohort and that population of 97,000 children. The reduction in costs of medications, reduced contact with healthcare, and the impact of improving school performance alone, and the mitigation of developing chronic childhood diseases into young adulthood and middle life would all have an economic impact on the ability to work and can all be modelled as part of this framework. This approach would present a far more detailed economic assessment and allow interventions to be measured in terms of clinical and cost consequences compared to the previous generalizable population methods, which is a significant move forward in the way that we're going to be able to assess the economic impact of interventions in the built environment and the business case to be submitted to governments and appropriate authorities for the return on investment on funding in the built environment. Next slide, please, Alex. So what do we gain by doing this more granular approach? We get a very much more specific assessment of the intervention and its impact, both on health and well-being and on the economic impact of doing interventions in the built environment. We get a far more accurate assessment of the clinical and cost consequences of any potential intervention. And importantly, we can compare what happens across Europe due to the standardized framework of the assessment of quality of life, which has already been used for 4 decades in the assessment of medical interventions and pharmaceutical interventions in the healthcare industry. And it will allow us to compare using things like incremental cost effectiveness ratios, the ability of investing in types of interventions which are going to improve health and well-being in the built environment. This demonstrates a significant impact on the prevention agenda compared to the treatment agenda. And what we are doing over a life course for people that we're intervening in through the built environment is investing in their long-term health and well-being, and as evidenced by some of the data that I've showed, improving both lifespan and health span. Economically, it changes our focus from a capex-based system to an opex-based system, because we become very interested in investing in the futures of our populations and not just in short-term capital investment in buildings. And that is a really critical issue for us to be able to discuss and deal with. This approach consistently has been used in health and well-being for over 50 years in the healthcare sector. And there are learnings that we can take from that sector and immediately apply to the way that we're looking at environment, clinical and cost consequences and describing them across Europe. We can make specific estimates across lifespan and health span in different indoor spaces, which allows us to stratify where our prioritized investment actually goes. If we can prove that we get the biggest bang for our buck in schools because of the lifetime of children and the health impacts are associated with good air quality in schools, that would allow governments and regulatory authorities to appropriately prioritize where quite difficult public monies can be invested in for the maximum outcome based on persons, places, pollutant types and exposure times. We also have established IEQ measurement standards such as BSI 4102, which is currently in Britain, and other standards that are available applicably to look at how we measure the pollutant effects alongside the health and well-being outcomes, which is particularly important if we're going to predictive modeling through data collection and streaming, which some of the other panelists and esteemed members will be able to talk about. Next slide, please, Alex. So thank you very much for your time. I'll move on to the next panel member.
Thank you so much for that, Phil. It was really interesting to hear how dynamic and complex it is really to understand the economic costs and impact. And I just want to say prevention is always better than cure, and you've really made that a very clear point. I would now like to turn to Dr. Salius, who will be looking. So we looked at the economic costs, but that's only half the coin. We have the other half of the coin, and that's the business opportunities. So with that, Salius, please, the floor is yours.
Thank you, Alex. Thank you for this opportunity to take part together with you in this conversation, and thank you for including me in the loop. I was there since the IAQ project started. I was one of the early followers of the project because my background is in academia. So, and I started analyzing air quality phenomenon as a social phenomenon. And once I realized that the technologies became low cost enough for people to buy and monitor, and those technologies are actually accurate enough to analyze data, to take data seriously, I realized that the change probably is coming into the paradigm, the way we think about the indoor environment. And therefore, I asked myself also, well, now I see everything I see now. What do I do with the knowledge that I gained? So I thought to myself, if I do not step in with the business idea now, I will probably regret it during the retirement. So I realized I have to take advantage of this, and I stepped into the market. And the voyage was not and is not easy, because to be the first in the market is not always very good. It's very difficult to be the first in the market. But interestingly enough, when I started doing indoor air quality consultancy and also indoor air quality monitoring, hardware reselling, I encountered close to 3 years ago, I started doing that, and I would have to spend a substantial amount of time presenting the problem of indoor air quality for businesses and for people. They were very interested, but I mean, it was difficult to make sales when you had to educate people. Now, a couple of years later, I would start doing that, and then would ask feedback about the presentation, what needs to be improved, and people start telling me that I spend too much time on presenting the problem because we already know the problem. So what I mean by that is that awareness about the indoor air quality is growing rapidly, and it is growing on the let's say on the corporate level as well as on employee level and individual level. So market pressure is accumulating, and those who are familiar with market trends and patterns and also anthropology of markets understand that sooner or later the paradigm is going to shift. Now, since I made this as a short introduction, I should probably tell now what I'm doing with my company and how I approach indoor air quality as a business. So next slide, please. Well, of course, that's an introduction. Let's go back to introductory slide. My background is social anthropology. I studied, I analyzed society. Social anthropology is a science which actually analyzes societies and change. So that's why I actually realized that we are at the brink of technological change, and we are bringing in, especially after COVID, we are bringing in the knowledge that we had since 1980s, and now this is the stage where we commercialize that knowledge about the indoor air quality. So that science actually brought me to establish my first technical hardware reseller, which was a Reset Air. But then I actually had to close it because Chinese had already taken that name. So I rebranded it to Bruegel. Next slide, please. So in a nutshell, what I do, I realized that there's enough hardware already installed in commercial buildings that actually monitors ambient air quality or indoor air quality. So the real problem in the market is that most of HVAC engineers which graduated, let's say 10 years, and now are working in the market and working in facility manager area, they are not familiar with indoor air quality paradigm. They are familiar with how many liters per second or cubic meters per hour you have to supply air, how the hardware have to be installed, all the math should be. The math should combine and be well, but it's all about the engineering and math. And when I started working in business, they simply did not know what the data is, what the data about indoor air quality is. So what I realized that the data about indoor air quality is basically lies dormant and unused in the facility management area, let alone employees did not know about their indoor air quality, although almost every second seminar that I gave on indoor air quality, because also I did use it my platform also as an educational platform. So every second seminar, or maybe even every seminar, there were people, employees of one or another company who would say, who would ask me to come and do indoor air quality monitoring or auditing in the venue, because employees know the problem of bad indoor air quality. So that it's just a question of cost, efficiency, and return on investments. So I realized that I see the opportunity in the market to actually collect that data into data lake or database, and from that data base, we would have to extract some meaningful information about the indoor air quality. So next slide, please. So instead of the indoor air quality data looking like this, which I understand, and some maybe panelists could read and understand, not only the separate indicators, the separate parameter, but also how those parameters correlate together and create some iterations. But instead of looking like this, or next slide, or maybe looking like this, which consumers and customers, they don't understand the data. So I realized I have to make indoor air quality into something which is in the next slide. It has to be something like, in this particular pilot project that you see on the left-hand side, this is a bunch of indoor air quality data, which basically, if you use particular formula, there are two formulas in the market about the viral risk indicator indoors. So using one of those formulas, you can tell that in this particular venue, there's a high risk of viral risk indoors. So, and both customers, and in this case was the bank, and their facility managers, they have had no idea about this data. They were very happy about me translating this to them, but I realized if I will be a translator, I won't be able to scale. So I need to create a platform that actually creates a meaningful, aggregates the data, translate it into meaningful iterations, and issue a automated communicative protocols or communicative information. Next slide, please. So that's just the background how this automation looks from technical perspective, of course, now including artificial intelligence, which analyzes and models it. Next slide, please. So this and with this I get some traction. That was one of the major pilot projects where we were able actually to combine energy efficiency and indoor air quality together by suggesting particular hardware to be installed along with indoor air quality monitoring, we showed that it is possible to get an insane return on investment in 4.2 years. Next slide, please. And that's another case, successful case and traction. So we can go to another next slide, please. So I thought I will use I used it as a cheat sheet, some questions from the panel discussion. So Alex, I hope you don't mind with that, but we will maybe be able to continue because I will not exhaust all the topics out there, but I selected some most relevant topics. So where are before we start there, I would have to say, where are the real market opportunities? So with the indoor air quality. So first and foremost, the real market opportunities is with HoReCa industry. Hotels, restaurants, spa resorts, etc. They have a very low profit margins. They mostly do the same thing. They have nothing to compete with each other. So indoor air quality will be the next big thing for them. But indoor air quality is still not commodified enough, and I'm in the process of actually turning this into commodity, so that it would be able to monetize it. So, but HoReCa industry is very much into that, looking into that, because customers already raising and asking questions about the indoor air quality. Interestingly enough, that whenever you talk with the HoReCa industry and spa resorts, they still very much service oriented, not customer oriented. So they would not monitor indoor air quality in hotel rooms. Rather, they would monitor indoor air quality in the restaurant, in the massage room. Or that's the interesting thing. I think the paradigm will have to change anyway. So of course we have to do something with schools, but because the situation in schools is terrible, and we have to, unappalling, we have to do something about, and all the other commercial buildings are here in the market for the taking. So, but there are three main points to go quickly, and maybe it's time already, Alex, to go to panel discussion because I think I see that I'm exhausting my 10 minutes time. So we will go with these questions.
if you can wrap up a little bit, maybe 2 minutes just to do a wrap up, 3 minutes to do a wrap up, and we'll get to these questions afterwards as well. But please go ahead.
Yeah, so all in all, what I can tell you about the market opportunities is that the main stopper currently for the indoor air quality to launch is, as I already mentioned, in the market is actually that it is not really commodified. It's still often when we suggest to improve indoor air quality, it's basically often you end up suggesting to buy a monitor of particular manufacturer, but the whole thing about indoor air quality is that we actually have to translate. We have to transfer people from data phase into iterations phase, where they would understand what actually indoor air quality, how allergy and asthma triggers work, how viral infections work, and that's at the end of the day, customers want to know how good is their indoor air quality, not how many how high VOCs or high CO2s are in the room. And the next thing, regulations. Regulations are also prevent, not more regulations, but more particular regulations is what actually prevents the real market opportunities for the indoor air quality as a business. So we can go to the panel questions, maybe. If you could go back a few slides, I have listed those questions. Yeah, so. No, let's, yeah, we can go from here. Sorry, Alex. So the first, so the first obstacle that we see now in the market is that people still are growing with knowledge about the indoor air quality, and the data is not always very clear. When we talk about indoor air quality, we usually talk about each parameter is a high CO2 or high volatile organic compounds, but what people are concerned is actually how tired I will be, how will my depression worsen, how anxiety will my anxiety increase, how about viral transmissions, etc. So these are the indications that eventually we'll have to go to monitor and communicate data this way. Next slide, please. And also, there is already, like Philip before told about the calculations about return on investment. There's already other, like Harvard studies, who indicated that there are clear return on investments for commercially oriented customers. You see these numbers here. These are based by Harvard studies, especially, for example, if the CO2 levels affect decision making. So you have studies which indicate how much better decisions are made when you have a clear indoor air, and also if you have fewer sick leaves, you have more deals closed, more sales, more customers served. So it's basically there are economic measures to be solved. Next slide, please. Now, this is the important one. Currently, we have in our green paradigm and an energy efficiency paradigm, we have human interest excluded from the paradigm. So it's not the fault of a capitalism that companies actually calibrate their buildings to work for energy efficiency rather than the health of people. We have to include people into equation when we talk about energy efficiency, because the real efficient buildings are not suitable for human beings to stay there, to be in the building. If you want the most efficient building, it will not be suitable for human beings. So, but if you want a efficient and also human-friendly building, we have to include humans into equation. And this particular graph shows in our pilot project that on this blue line, if you see here, these blue lines, you see my cursor? No. So you see these dips, these are ventilation rates. These are air supply rates, and that this is example of the most efficient building in Lithuania, award-winning building in terms of efficiency. So it is calibrated to work with a synchronization with the grid of the city, electrical grid of the city. So when there's something in the grid, they have to switch off something in the building so that the buildings will be efficient and in sync with the grid. So you here see these dips, you see this, they actually shut down ventilation in the building, energy efficient building. And green line, I show you one line, but there are many lines, so lines much more many. So this green line shows the spike in the CO2 levels. But in this particular pilot project, you see, yes, in this project, you see how our hardware installed actually mitigated pollution. Had there been not hardware installed, you would see a constant increase beyond 1,100 ppm. And at the end of the day, this energy efficient, award-winning energy efficient building would have a absolutely terrible air pollutant. So whenever they switch ventilation, they have an increased pollution. Next slide, please. And then also we have a lag in regulations, and as I said already, it's not that we need more regulations, but we need more particular regulations regarding indoor air quality. Since especially if we are in the business of making buildings, commercial buildings and public buildings as well, more indoor air quality friendly, we need, and these industries and sectors are very conservative. They will comply with regulations only, or they will comply with they will go with the return on investment. So but unless there are no regulations, they would not risk with investment or high investments. So we need more particular regulations about indoor air quality as such. And then we need all the EU-funded infrastructure actually directed towards those who want to actually improve indoor air quality hardware in their building and at school, especially in municipality in Lithuania. We had a case in one municipality in Vilnius city that they actually said that actually health ministry said, we know the problem of indoor air quality, we know the problem about that in schools, we won't do anything because it needs a massive investment. So next slide, please. Alex, next slide, please. So with that, I think I've used enough of your time. If there's questions left, I'm ready to answer. If not, thank you for your attention, and let's hope to connect with you next time.
Thank you very much for that, Dr. Salias. It was one, you've made a lot of very interesting points about the paradigm shift, how about people becoming more and more aware of indoor air quality and the market opportunity there, particularly for things like hotels, which is a very important thing. There is a market out there for all the technologies that we're developing as the ideal cluster project. So with that, I would like to give the floor to my dear colleague and friend Leticia from the K-Health in Air project to have an exploration of what we could do with all of these innovations to ensure continuing impact. So with that, Leticia, please, the floor is yours.
Thank you very much, Alex. So good morning, everyone. My name is Leticia Pérez from KBLOC, and I'm here today to share with you the K-Health in Air's approach to exploitation, but with a particular focus on public value rather than purely commercial returns. Alex, please, following slide. Okay, so quickly for context, K-Health in Air is an Horizon Europe project running from 2022 to 2026, coordinated by Cardiff Technology Center with 18 partners from 8 European countries working together to understand and improve indoor air quality. Alex. Okay, as all of you know, indoor air quality refers to the quality of air and in and around buildings and structures, especially as it relates to the health and comfort of building occupants. In other words, the quality of indoor air dictates how pollutants, temperature, humidity, and other environmental elements influence the health and well-being of individuals who spend time, whether temporarily or permanently, in a closed space. Following slide, Alex. Okay, so understanding and controlling indoor pollutants is crucial, but here's the problem. The current landscape is fragmented. Researchers face multiple disconnected data sources. Policymakers lack comprehensive evidence linking indoor air quality to health outcomes across different settings. Industry developers don't have a standardized benchmark for healthy indoor environments. And finally, citizens have very much limited awareness of indoor air quality risk and in their daily lives. And there is no lack of studies, but there is a lack of studies approaching indoor air quality holistically, accounting for multiple pollutants, their sources, their interactions, and crucially protecting vulnerable populations. And this is the systematic gap that Key Health in Air project addresses. Alex, please. Okay. So Key Health in Air overarching goal is to evaluate on the basis of scientific evidence the effects of indoor air quality on health. But how we do this is what sets us apart. First, through research activities based on an extensive monitoring campaign of both chemical and biological indoor air pollutants across several highly representative locations in Europe. Not just one pollutant, not just one scenario, but a comprehensive approach. Second, through in-depth analysis of pollutant sources, their interactions and their correlation with health problems, combining theoretical analysis, clinical trials, and in vivo and in vitro laboratory tests. And third, critically, by providing cost-effective and easy-to-implement measures to monitor and improve indoor air quality, along with practical guidance to support real-life interventions, evidence that translates into action. Following slide, Alex, please. So we are doing this across 5 pilot sites in Spain, Netherlands, Norway, Germany, and Poland and Austria, covering hospitals, schools, homes, workplaces, and public transport with 3 years of continuous data collection. Alex, thank you. This work is generating significant public value investment, new indoor air quality sensors with advanced filter and monitoring, the open access platform that will be detailed in the following slides, analytical models and algorithms, scientific and non-scientific publications on indoor air quality impact on health, guidelines on indoor air quality for health improvement, on air sampling and sample analysis, also new paints for air purifications, an hybrid care platform, which is called Kia Plus, and finally, a aspergillus sensor. Alex, thank you. So now let me focus on that open access platform, because this is not just a deliverable, it's our commitment to lasting public benefit. The platform has 2 different modules. On the one hand, the knowledge sharing module led by Alliance, which provides tailored content for the quadruple helix stakeholders. And on the other hand, we have the data management module led by Atos Evident, which houses all of our indoor air quality and health data. Both of these modules are designed to be free, accessible, and sustained, ensuring Europe's investment continues delivering value long after the project's end. Alex. The knowledge sharing module provides knowledge fields, policy briefs, educational materials, and all of the content developed within the project to all tailored to the different audiences. Why does it matter? Because most of indoor air quality information is either too technical or too scattered. So the knowledge sharing module bridges that gap. The data management module is an open source tool with modular architecture, providing researchers and innovators worldwide access to extensive, high-quality indoor air quality and health data. The public value of this module is clear. Researchers can build on our work without commercial barriers. Industry can develop better solutions, and policymakers gain robust evidence. So how are we exploiting these modules? Our approach prioritizes public value over commercial gain. So to design the the exploitation strategy of the platform, we follow a structured methodology, first characterizing both modules, reviewing exploitation goals, conducting market analysis, identifying options, detecting risk, and finally designing a comprehensive roadmap for each of these modules. So now let me talk about the specifics, starting with the knowledge sharing module. Okay. For the knowledge sharing module, our exploitation focuses on sustained knowledge impact beyond the project. First of all, in an immediate term, the project plus 1 year, the module will be hosted on our website with free, open access and regular updates in multiple languages. On the other hand, for long-term preservation, we are archiving materials in European repositories like Zenodo and OpenAir, integrating with the ideal cluster resources and partnering with policy platforms like European Environment Agency and the WHO Europe. Alex, please, for the following one. Thank you. So the ongoing impact pathways of the knowledge sharing module are diverse: materials for health and environmental curricula in education, resources for public health campaigns, guidelines for occupational health specialists, and evidence for indoor environment regulations. Our broader vision, contributing to a healthier, more informed Europe where indoor air quality is recognized as a fundamental public health priority. Okay. This slide shows our quadruple helix approach to knowledge dissemination, making indoor air quality knowledge accessible to all. For academia and researchers, scientific findings, methodological insights, and data framework. For policy and decision makers, actionable policy briefs, regulatory gap analysis, and cost-benefit evidence. For industry, design guidelines, best practices, and innovation opportunities. And finally, for society, knowledge fields, educational materials, and practical tips for improving air quality at home. The public value here is empowering informed action at every level of the society. Now, turning to the data management module, our commitment to sustainability here has two pillars. First, the technical sustainability. In this sense, CARTIF, which is the project coordinator, will maintain and host the platform after the project with full documentation and open source release, enabling community development. And then data governance. Each data provider retains control over their data set with flexible access model respecting privacy and IPR, all GDPR compliant. Alex, please. Okay. What exactly are we offering Europe through this module? First of all, comprehensive indoor air quality data sets from 9 different scenarios, including hospitals, schools, homes, transport, and workplaces, as mentioned before. Then health correlation data linking air quality to real outcomes, advanced algorithms for pattern detections, and finally, an open source architecture built on Fireware and Apache ecosystem. The public value proposition here is fourfold. For research, independent high-quality data advancing indoor air quality science without commercial barriers. For innovation, a foundation for developing next-generation monitoring solutions. For policy, evidence-based insights supporting new regulations and standards. And for the society, transparency in environmental health data that builds public trust. So just to finish, to conclude, our commitment is clear. By making our comprehensive data sets and knowledge resources openly accessible, we are establishing a foundation for improved indoor environments and healthier communities through increased awareness of how indoor air quality directly impacts human health. This is what exploitation means for the key health in air projects, not just commercial opportunity, but lasting public benefit for Europe. And yeah, this is just a picture of the great consortium of the project. So thank you very much.
Leticia, thank you so much for that really nice look at the work that's going on in K-Health in Air. I'm very impressed to see all the divisions of your exploitation results and kind of attached to different stakeholders. You've given me some ideas for my own, so I might be stealing some ideas from you, but thank you very much for that. So now we'll be heading to something a little bit more specific, and we'll be taking a look, and I'll introduce my dear colleague, Jaimo, and friend, who will be introducing the the Know Center data platform and data visualization dashboard, and I'm excited to show us the key exploitable results. So with that, Jaime, please, the floor is yours. Take it away.
Thank you. Now from the, let's say, EDIAC perspective of things, where we had the look of, well, quite similar to things that we already heard now. But Alex, if you could move forward to this slide. Exactly. We designed a data platform here for data collection in a central place where we can constantly monitor also the data quality and quantity, where we give to our scientists and researchers an easy set of tools so that they can work with the data, obviously still complying with data security and data privacy rules, because it is obviously confidential data. But after all, we've also wanted to comply with the FAIR principle where we can and where it's allowed for the data. And on the next slide, then there is the way how we did it. We get data from all over Europe, as it's visualized by the arrows on the left-hand side for our pilot sites. And then we have several different components in there that are then handling the incoming data, for data input, for data interaction, for data, for the central keys of the data platform. And the first things I would like to talk about is the data input, where we allow data to be uploaded directly, where we can synchronize with other Frost server instances, and where there's the possibility to upload data in CSV format into the central components, which are shown here then, which is for time series data, the Frost server, and we have IRODs for all file-based data, for instance, surveys that we do with our test participants. And we can also publish data from the Frost server to IRODs if you want to use it in a publication, share with third parties, and so on. We have Jupyter Hub installation to really work with the data in R and in Python. And later on, I will show you in detail what the EDIAC dashboard can do. But before that, there are a few more things that we just need to work with the whole platform, like user management and navigation. And also there's a big export facility for data from the platform to share with third parties. And on the next slide, then we already see our overview about all the components where the people can navigate to. And then I'll now switch over to my main screen, and I can give you then a live demonstration of what we have here. Alex, could you just confirm that you're seeing my screen and that it's working? Excellent, thank you. So the first thing here, what you see is the data monitoring part, where we have a neat overview about when data is incoming, how much data we do have from which sensor at what time. This is for our location in Seville, where they had handheld devices. That explains these lines here, where we only have limited data and not a consecutive thing. The second thing then is the troubleshooting. When you have the data incoming, and I now selected here Ferrara in Italy and the last 2 weeks, and then we can look at the data, see if we have consecutive parts of zeros, if we have negative values, obviously for concentrations like CO2 or NO2. This is obvious outliers and obvious wrong data. We can look at the mean values and the number of unique values and so on. And this is obviously done to ensure data quality. There's the ability to download a report on this so that people then can look at their measurement devices and see actually what's wrong there. And then we come to the core, to the EDIAC dashboard, where we then can really drill down and look at the data that we have. Here, the first thing, we can select various regulations, or various indoor air quality regulations, which then give us a rating from good to extremely poor about the indoor air quality. For this demo, I selected classrooms and schools, and I have here one from Italy, one from Estonia, and one from Seville. And then we can here have a comparison about the different values that we have. So the first one from Ferrara in Italy, second one Estonia, third one here in Seville. We can even look at the time series, also where it falls to inspect it a little bit more in detail. And what we also can do is we can break it down into different time series so that we here then compare it for the 4 seasons that we have during the year. And then down here at the bottom, we have visualization for sample size. Obviously here you easily spot that there is very few data in summer, so the summer values might not be as reliable as the spring or winter values. And you can also look at the standard deviation, giving you an estimation how the values vary over time. Now I'll hand back to Alex and the presentation. And would you please go to the last slide in the presentation there, where I summarized then what these results and the systems that we had here in the EDIAC project actually mean in terms of market potential. I think it's just the first page now, so yeah, just go on. And yeah, exactly, here are some screenshots which you get in the presentation afterwards, which you then can also look through on your own and give me some questions if you have one. Obviously, yeah. And so our value proposition is that we, as I'd like to show you with the architecture, have really versatile and more and modular data platform that is also used already in one other project in an adapted form, because they have different data, but still. And we have a focus on improving the data quality, and so that we can compare then the data, because the data quality, as we notice really quickly, is the key for all this. Looking forward, for target customers, we would have HVAC and air quality contractors, suppliers that work with this data. They need a tool to collect it, to manage it, to analyze it, and obviously then also building operators and owners who are interested in the actual results that we get this out. And due to our extendability and customizability, we can easily include other KPIs that a building operator might be interested in, or we could even compare it with other measurements, for instance, energy measurements. I guess there is some merit to comparing indoor air quality, for instance, with the energy consumption of a heat pump installation. That was my part here, and then I'll hand back to Alex.
Thank you so much, Jaime, for that deep dive into the Node data platform. It's something that I think has a lot of potential, particularly hearing all of the discussion today as well. Obviously, I'm a little bit biased. I must also note as well, we have other dashboards, like a user-friendly one working on with DEDA, which we will show at a later date as well. But this forms a compendium of really great key exploitable results. And going to what Leticia said, we obviously have the same view that we want to have the maximum social impact possible, but we also want to say that this commercial opportunity is there. So, Luca, you have your hand raised. I'll ask all the panelists to turn on their cameras. Luca, if you'd kindly ask your question in the chat, and we'll be very happy to give you the floor later on during the question portion. Leticia, if you could kindly turn on your camera as well. and we'll begin with the question portion. Guys, I ask you to be a little bit swift because very happy to see lots of questions in the chat, lots of movements in the chat. So we'll have a lot of things to kind of talk about later on as well. So to just be a little bit more concise. So first we'll head to Phil. So Phil, I mean, it was really great to see the complexity of understanding the economic costs. How do we quantify the economic costs of poor indoor air quality across Europe, and which categories matter most? Please, Phil.
Thanks, Alex. So to be very succinct, I think this sector that we're in is at a divergent point. Yeah. We need to make a decision about what methods we're using to collect data and whether we're going down a data modeling approach or an actual more granular approach about interventions, because I think the key decision for regulatory bodies and governments to make is how specific they want the data to be in order to do intervention, right? So the flaws around this are data modeling is good for generalization, but not specificity. The weakness around data collection, it requires costs and research to do it. Okay, so we need to be able to work out which approach we're taking, and it's not an either or, you might have to do both. Yeah, but it's quite clear from the existing data modeling that the burden of disease and therefore the clinical and cost consequences of disease due to poor environmental quality and air quality are significant and considerable. My perspective would be, in a system of finite resources, we should concentrate and prioritize government investment on the groups that are most likely to benefit. And I think that there's a compelling case to say across Europe, we should be concentrating on improving school environments and measuring the clinical and cost consequences of doing that appropriately, because they have the biggest benefit overall for general population gain because of the lifespan and the health span that's associated with young children.
So we had a really good presentation from our Adnan Kusovic from the I believe University College London, and he in fact talked about the spirometer and the lung function as a trajectory for health. So it very much aligns with that, and it's really interesting to hear that. And I obviously, as somebody who worked in child protection, really strongly agree. I'm maybe biased towards the focus on children. So Sally, so we've taken a look at maybe how we measure the effects of indoor air quality, and we see it's very complex, and maybe we need to focus on particular groups. I think that was one of the biggest points. So based on your experience in the IAQ technology and services market, where do you see the strongest commercial opportunities?
Sorry. So as I already mentioned, thank you, Alex, for this question. As I already mentioned you before, I think the most rapid change in implementation of indoor air quality technologies will happen in HoReCa sector, and it's happening right now already. But also there's an untapped potential in the market is for actually business tenants who rent, let's say a big company rents 1 or 2 floors in the commercial building. They basically have no say about indoor air quality, and whenever they complain, the facility managers usually say it's up to compliance, everything's fine. So by creating actually a platform, that's what I'm trying to tap into. If we enable them, they are buyers of better indoor air quality monitoring platforms and hardware. So I think one of the best opportunities to enable those business tenants, let's say, to have the say about indoor air quality, and that would probably push the market forward enormously.
Very, I think, important points there as well that you've highlighted. I think with growing awareness as well that you've mentioned, the opportunity now, I don't think has ever been better than before. So with that in mind, and talking about opportunities, Laetitia, what are K-Health in Air's, and I should have corrected this, apologies, most promising exploitable results, and how are they positioned for real-world uptake?
Okay, thank you, Alex. Well, first of all, as I saw in the presentation, the Key Health Inner project has generated 11 key exploitable results with different exploitation pathways. And I should clarify that our fully developed exploitation strategy is current for the open access platform, included the knowledge sharing module and the data management module that you have seen in the presentation. And for the other results, the exploitation strategies are still being discussed, and refined within the consortium. So, but let me highlight that our most promising results are, first of all, the new indoor air quality sensor with advances and monitoring capabilities developed by InBiot and Mans and Hummel. This includes a portable indoor air quality monitoring device for individual exposure tracking, which is particularly valuable for outpatients, vulnerable populations, and occupational health applications, and also an intelligent integrated system that combines real-time monitoring with automated air purification. So in this sense, InBiot and Mans and Hummel are exploring the different options for bringing these innovations to the potential users. Then we have also the hybrid care platform, which is called Kia Plus, that has been developed by the Hospital Clinic of Barcelona. And this is a nurse-led protocol supported by a home monitoring kit, combining indoor air quality measurements, self-administered oscillometry, and also heart rate variability sensing for high-risk respiratory patients. It has been validated with more than 200 patients in Barcelona, and now they are in discussions about potential pathways for adoption by healthcare systems. Then we have also the new paint for air purifications developed by the University of Agder in Norway. And this innovative photocatalytic paint works with natural indoor light, not requiring UV lamps. So the university now is exploring technology transfer opportunities with paint manufacturers. And finally, we have the Aspergillus sensor developed by CSIC. And this is a portable electromechanical nanobiosensor for rapid on-site detection of airborne aflatoxin B in grain storage and feed processing facilities, addressing a critical occupational health gap. But of course we have also other highly valuable outputs designed for open dissemination and public value. But it's true that these are positioned for stakeholder adoption and policy influence rather than commercial exploitation.
Seems like you have a very nice package of both commercial opportunities and also social impact. Obviously, the IAQ project's a big concern for us, the impact part. So, Jaimo, with the impact part and also with the commercial opportunities, how does real-time data visualization support better decision-making for business, for building owners, schools, and public authorities? Please, Jaimo.
Well, I think that this is one of the connecting themes through all of the 4 talks that we heard here, that you really need the data. You need the data right now, and you need it from the right buildings, the right locations, and the sites that you have under investigation to then really make the decisions and say, okay, the air quality is acceptable or is not acceptable. And also, I think the comparison between sites is a very important point to really pinpoint down what is possible or not possible, and also then the KPIs, which we are also seen in 2 talks or 3 talks, I think, that you don't have really to look at the raw data, just have loads of graphs and you have to click through them, but you can grasp the information that is in there quickly and decide quickly and then really react on the data that you have, but in a way that it's feasible and possible for the decision makers.
It's good to see that. I think data is one of the biggest opportunities that we have, and visualizing the data, I think, is one of the biggest opportunities, maybe market gaps at the moment. And I know, and I want to actually give a shout out to Phil. You'll be next, coming on. So definitely get a shout. But I want to give a shout out to Sotiris as well. I'm not sure if he's still able to be with us now. But he's in fact working very much on this sort of UX and understanding and accessibility, right? So it's a very important point. But Phil, please, your comments there, and yeah, and then we'll go to the question.
So this is a general comment on what's been discussed, okay? And in relation to particularly the biggest intervention we can do is to change human behaviors, yeah? So in that respect, if we lived in a world where every building would tell you what the IAQ of the building was as you entered that building, but also assess for you the health and well-being impacts of your exposure time in that building, right? So if you're in a school, you're going to be a child in a school for 8 hours. If you go to Costa Coffee, your exposure time is less, but the pollutant level might be higher. Yeah. Data visualization and the transmission of that in a way that people can understand it is the thing that will drive changes in human behavior, which will allow us to gain the biggest health impacts that we possibly can get, because people will start deciding which environments they want to go into and interact with and work at, and which environments that they won't. That in turn will cause a commercial response from employers, people who provide services and the service industry, people who provide goods, and people who actually let and use and own buildings to start investing in air quality, because air quality becomes a currency that people become very familiar with, and an opportunity and a choice that they make about where they want to work, where they want to send their children to school, yeah, where they want to spend their leisure time, which coffee shop they want to take their coffee in. And that drives the entire system in a way that public and organizational bodies will have to invest less in, because it'll become a commercial issue for those people who actually manage and own buildings. And I think that's the biggest change we could achieve with all of this, which is changing human behavior.
Have to very much. I think knowledge is power. And I think when you give people the knowledge in order to act, and you give them the tools to act, you can have very powerful, and I take smoking as one of the really key examples, right? If you look at the US now, I mean, the number of smokers has decreased dramatically. In fact, I used to smoke and I remember feeling ashamed of smoking in the United States. So public health campaigns and behavioral change, I think, can be one of the strongest things. So just to shout out that as well. Okay, Salius. How can better measurement and harmonized support methodologies support European policymakers and investment decisions? Please take it away.
Well, first of all, I think someone already addressed this slightly better than I could, because I'm not a scientist in this particular area. But I could tell that when I'm also in data aggregation and visualization problem development, developing a problem solution for that. Developing a solution for that problem, how to visualize data. So what I encounter is actually that we still have different methodologies or not enough unified methodologies in the indoor air quality measurement. And also there's another distraction especially for policymakers. I think that the main distraction now is that we somehow what takes away the attention from indoor air quality is actually outdoor air quality. But if we look anthropologically, so we are we are indoor species anthropologically speaking. We dig burrows, we build houses, and we spend up to 90% of our time indoors. So outdoor air is not that much affects us if compared with the indoor air quality. So what I see now in a regulatory environment is that there are quite a lot of attention is about the outdoor pollution, which is important issue. But what I also can see from measurements is that, and also I have graphs to show that outdoor pollution comes and goes, but where it goes exactly, it goes indoors and stays indoors. and they have and very good graphs in the with the bank project in the bank, where we saw how pollution outdoors actually infiltrated the building and stayed indoors. So if we would get rid of this distraction, or maybe moderate this distraction about the outdoor and indoor air quality, and would consider dedicate more attention to the indoor, and also unify methodologies about the VOCs, about CO2, because what I hear from researchers, some emphasize the importance of CO2 because of cognitive performance, airborne infections, etc. Others say, no, CO2 is not that important, it's VOCs, and etc. So we have to actually work on that a little bit more, so that we'd agree on methodologies and priorities in indoor air quality measurement and indexing. And that when we have this done, probably we can go next step and just better policy and regulations.
Thank you very much, Salias, for that kind of look and those practical examples as well. Leticia, Jaimo, please, if you could be a little bit concise so we can jump to the questions. So, Leticia, please, how does K-Health connect scientific insights to practical solutions for industry or the public sector?
Okay, thank you, Alex. Yeah, I think we connect research to practice through 3 different mechanisms that we built into the project from the very beginning. First, the open data infrastructure. So I have shown today, we have developed as an open source platform that makes project data, knowledge, and tools accessible to researchers and innovators. So this allows them to build on our findings and create future indoor air quality solutions without commercial limitations. Second, we have also involved industry and public sector actors throughout the entire research project, not just at the exploitation phase. So these actors gave us continuous feedback during development and during the implementation of the pilots through stakeholder engagement activities, including workshops, co-creation sections, impact mapping activities, consultations. So this meant our results address the real operational needs, and I think this dramatically increases the chances or the opportunities they will be adopted. And finally, I think that we create different content for different audiences. As I showed before, our knowledge sharing module provides targeted content for the different stakeholders of the quadruple helix. So policy briefs for decision makers, educational materials for schools and public awareness, technical guidelines for practitioners. So we are not just publishing scientific papers, but we are also producing actionable tools in formats that the different users can apply. So I think this is the way.
Thank you for being concise, but also comprehensive. Jaime, what are the main commercial use cases, whether as a standalone market product or as an integrated consultancy service for the No Data Dashboard? Please.
Well, the main part is always when people want to measure and use their air quality as a selling point. For instance, in hotels who want to offer their customers an overview about the air quality in there, or commercial operator of office spaces who are fighting for customers renting their office space. They can offer this as a service to them to tell you, yeah, my office space has a better indoor air quality than the competitors' offerings. And with this, then we try to gain some momentum, try to gain some market, so that it's then also is something that is possible and feasible in financial terms for public authorities, because we all know public authorities are strapped for cash at the moment. But then also this can come into schools, for instance, operated by public authorities.
I think that's a very nice example. Okay, we have a lot of questions in the chat. Some I have to thank Phil and others for already answering some of the questions there. I'm gonna make Phil, because he gave a really nice, I was reading it in between. So I'm just going back to the question. It was posed by Andrea. And Andrea had asked, the uncertainties will exist in reliability of data collected and the methods used and applied. The data is the greatest level of uncertainty, especially in the collection of IAQ data sets and the hardware being used. We already experienced a 25% difference in monitor recording of IAQ parameters measured with the same manufacturer, and this difference is way too big to develop a model of. The method approach of QOL is very reliable and has been used over 5 decades of the assessment with regulatory bodies in health, so less likely for uncertainty. So maybe you had a really nice reaction to that, Phil, if you just want to give a summary of that.
So, Alex, I think that the point is, and as we've discussed before, there's a modeling approach with data, and then there's the granularity that we need to specifically look at the cost investment of interventions in improving data, aside from the investment required for data collection. Okay, so everyone talks about monitoring and being able to collect reliable data on particulate matter, gases, and other variables according to standards. But the real interventions that affect human health and well-being are interventions around ventilation, systems interventions in the way that people change their behaviors, okay? Being aware of the impact of things like cooking and domestic activities on indoor environmental quality, etc. Now, we can answer these, but in order to do this in a way that governments can interact with us and understand where they're putting public sector money or private investment for private investors, we do need to be very specific about being able to assess what the impact of an intervention is, aside from the ability to monitor differentials in indoor pollutions and variables, okay? So the methods we use, how we're applying them, and what they're going to produce for us in order to determine a very specific and sensitive investment in a particular investment, and being able to measure the clinical and cost consequences of it are, right, require additional funding and research, but have been used in other sectors. We don't need to reinvent the wheel of it, but it does require experts to be able to do it. And part of our organization in Raven Delta Group is to make sure that we support the likes of people who collect data, stream data, to supplement that in a way that allows us to be very precise about which populations we're targeting, what the economic and clinical consequences of targeting that are, and what the return on investment is for government agencies and public sector to be able to invest in this. Yeah. So that's why these types of approaches are very important. And the collaboration is to ensure that we get the correct expertise from groups across our communities to be able to provide the specific expertise to be able to do the health impact assessment.
What I love about this, maybe this collaboration there between different kinds of sectors, I think we tried to model that today with our speakers. I think we had a really nice kind of a representation there. So very much take that piece of advice, and I think it's a really strong one, right? This is something that is very, we'd like to think it's niche, but it's really not. It's something that's very all-encompassing and affects, I mean, we spend 90% of our time indoors, as Salis has mentioned, right? So this is not something that is niche, but this is something that should be central, needs to be central. Okay, we have a very nice question. It's for all of you. Okay, Salis, Leticia, and Jaime. We're going to go like a classroom and just do it in the order we'll be doing it at the beginning. So what is your vision regarding the role of robust platforms for IAQ data support and management in addressing the economic and social impacts of indoor air pollution, and what types of cost reduction do these types of platforms generate? If you could be very quick, because there's one more question I'd like to pose to all of you as well. So just 30 seconds, please. First with Salias.
Well, I know from practice that the only cost reductions, the type of cost reductions that sells in the market regarding indoor air quality is basically how indoor air quality monitors will help to reduce the cost of energy costs. That's currently the only thing that sells. But I think what we have to do, if you're asking about the vision, is what we have to do is we actually develop and popularize the idea of health performance indicators of the building. And we will, as I see from the panelists, that we already have plenty of data to actually construct the HPIs. And then if we will show the cost reductions for businesses, that would sell very well, I would say. That would be their vision and future.
Thank you, Salis. And your views on this, Leticia?
Yeah, of course. Yes, I think the robust indoor air quality data platforms are essential for moving from anecdotal evidence to systematic understanding of indoor air pollution's economic and social impact. The role is enabling large-scale and comparable analysis. So without a standardized data infrastructure, we have fragmented studies that can't be compared or aggregated. So these platforms, like our data management module, for example, allow researchers across countries and institutions to pull data, identify patterns, and also quantify the impacts at a scale that individual studies cannot achieve. So this creates the evidence base needed to justify policy action and investment. In terms of cost reduction, I think these platforms generate could generate savings in different ways. For research, they eliminate the duplication because maybe researchers don't need to reveal data and infrastructure from scratch for each study. For decision makers, centralized data enables evidence-based targeting of interventions. So instead of implementing expensive solutions everywhere, you identify where problems are worst and intervene strategically, optimizing the resource allocation. And I think for the society broadly, better data accelerates the translation from research to policy to implementation. Faster identification of effective solutions means earlier health benefits and productivity gains. Reducing the cumulative cost of poor indoor air quality on healthcare systems and lost working days. So the long-term vision is, to me, that open data platform democratize indoor air quality knowledge.
I think it's part of our European values as well, right? If we look at what's going on in the US at the moment, that really this open source, open data is what sets us apart.
Yeah.
Jaime, please, your take on this.
You just said the right word now, open source, meaning there is some sort of standardization. Because if we all create our own platforms, obviously that doubles cost. But if we go for standardized things, that does not necessarily mean that there is an European standard for everyone, but it can also mean collaborating in open source project. This reduces costs, like it's done, for instance, for the Linux kernel or things like that. And the other thing is scale. Think about what the costs are for Netflix or so. Even there's a hideously big infrastructure behind it. But if you got the scale, if you roll it out for that many subscribers, this obviously then brings the cost to somewhere where it's feasible.
We have one more, and it's very, very, it's a bit of a different one. It's a little bit more, and it's more in general, but we can think about the economic costs as well, and we can just apply that there. But Madeha has asked, what are your thoughts on improving indoor air quality using microorganisms? I'm just going to attach something else to be more in line with the theme, and that is in terms of the economic efficiency. What do you think about that? So we'll go one by one. I'm not sure if you've had anything about this, Phil.
Okay, so when we talk about indoor air environmental quality, at the moment, the conversation has been very specific about a series of pollutants, gases, and environmental factors that we measure routinely, okay, right? But IEQ, or indoor environmental quality, includes much more than just measuring that. It includes how you design a building, what materials you use in a building, the implications of biophilic design and microorganisms in that building, how you measure other things, including water quality, pathogen surveillance, right, in buildings, okay? So we are only really tackling one component of indoor environmental quality, not the entire building. And I think we need a holistic entire buildings approach, and you need to start involving and having conversations with organizations that take a 360 approach. So my group don't look at just one parameter in Raven Delta. We look at building design, we look at materials, we look at pathogen surveillance and how you monitor what's happening in buildings, whether that's Cryptosporidium, Legionella, potential pathogenic outbreaks, prospectively from a prevention agenda, and how they integrate into a system that a human being can understand what's happening around them, which goes back to my colleagues' points around the importance of open and visible data being able to be presented to people using a building. Okay, so if we're going to have the greatest impact on population health and well-being and the economic burden around it, we need to take a far more holistic approach, which only certain groups like my group have started to think about, but we can collaborate and federate in a way that protects the health and well-being and the economics of our populations now and for future generations.
I think the mantra of today is open data. That's definitely for sure. And I definitely think as well, this is just the beginning of the discussion, but we're going to be able to kind of build on collaboration here. Anyhow, so excited for that. Thank you for that nice call there at the end, Phil. So Salias, and then Leticia, and then Jaime, if you can be quite brief, because we've gone past the time now. But yes, please, your words on this.
So I am not an environmental scientist, but I've read some studies about particularly using microorganisms and plants, by the way. So to be brief, as far as I know, this is a matter of science fiction so far, because indoor air pollution, as Phil already mentioned, is a complex thing, and microorganisms, if they can, they would deal probably with one or two parameters at the most. Now, from the studies that I know, if you want to make an impact with plants, you basically have to create an Amazon jungle in the office with the open roots, which is not, and also sustain it. So and that will solve only the CO2 parameter, would probably cause volatile organic compounds or something else. So basically, short answer, as far as I know from scientific studies I've read, it's basically science fiction.
Leticia?
Yes, a question about microorganisms, Alex?
Yes, please. I'm asking all speakers just on this one question. And Salias, by the way, thank you for that. We might disagree slightly at the IAQ project on that, but I think it's a fair point, a very fair point to make. But Leticia, please.
Yeah, yes, well, I'm not an expert in microorganisms based in the quality solution, but it's true that it's an interesting emerging field. The concept has potential. However, I think there are important safety and effectiveness considerations that need validation. From our project perspective, any biological approach will need to be carefully monitored and integrated into comprehensive indoor quality management systems. The key is providing this solution actually improve health outcomes in real world conditions, not just laboratory settings, but I would recommend consulting with a specialist in this specific area because I'm not the person to answer that.
It was a very nice answer still, indeed. So thank you very much for that, Leticia. And Jaime, last but not least, for our final question.
Also from my side, measuring that microbiome and their influence is really tricky, and getting this as similar as I don't know, CO2 or temperature measurements or so, we're far away from that. I absolutely agree on that. However, the holistic picture of indoor air quality is the desired target, and we have to just do more work to see how we get there and how we close the gap and also can capture these microbiomic influences in the future.
So I have to thank you all for this really nice idea for my next webinar, but it won't be the next webinar. But this is another webinar I'm going to think about doing. I think it's a good idea. Let's see, IAQ on the microbiome. We might invite Salias back again for that, and all of you as well, of course. So with that, I always have to announce our next webinar, which will be on the 23rd of January. It's going to be about the promise and peril of AI, IAQ. I forgot to put that in the title, so do forgive me. Sensor calibration. It's going to be done with one of our a new project that's come out that's called Next Air, which is about training outdoor and indoor air quality scientists and secondments and different exchanges and creating competency frameworks. We hope you can join us for that one. It should be very, very interesting. The registration link is in the chat. We encourage you to become a part of our vibrant community by joining the K Health in Air project community. You're going to have lots of different QR codes to scan. Get excited, please. I hope you have your phones out. Ideal cluster community, along with various other initiatives for seamless updates and information. Please scan the QR codes displayed to follow our LinkedIn pages or YouTube, whatever is your social, we have it. Yeah, from the Ideal Cluster, the K Health in Air project, and of course the IAQ project. So I'm just going to hold it there for a few seconds on the Ideal Cluster project. I hope you're quick. I hope you're going to follow all of these different social media channels. Okay, and last but not least, us. We extend our heartfelt gratitude to our panelists for their invaluable perspectives, and to you, our audience, for the engaging discussions that brought this event to life. Today's obviously special because we're right at the holiday season, so I want to wish you all a beautiful holiday season with your loved ones, and of course, wishing you for this holiday season excellent air quality, both outdoors and indoors. Thank you and goodbye. Wishing you all a lovely day as well. Ciao, ciao.
Thank you, Alex.
Thank you.